Kidney stones can be painful and uncomfortable to deal with, but the good news is that they can often be removed with minimal intervention. If the kidney stones in your system are small, drinking a large quantity of water can help you urinate them out. But what happens when it grows larger or the water remedy doesn't work? Here we'll look at the best tips that can be used to remove kidney stones, including medical treatments, lifestyle changes, and natural remedies. Natural remedies to remove kidney stones. Number 1. The lemon juice solution. A recent study showed that citrate is a good-to-go fighter for removing kidney stones from the body. Lemon juice is high in citrate, which can help prevent kidney stone formation, making it a good recommendation. It is a popular home remedy because it is rich in citric acid, which can help break down and dissolve stones, and because it is a natural remedy. When you drink lemon juice, the citric acid creates an acidic environment in the urine, making it difficult for crystals to form. If there are already existing stones in your kidney, it will also break it down and render it powerless. To use lemon juice as a remedy for kidney stones, mix the juice of half a lemon with a glass of water and drink it 3 times a day. You can even use it to complement your meals instead of taking the normal fruit juice you love. Be aware that excessive lemon juice intake can harm the body, leading to upset stomach, acid reflux, and other gastrointestinal issues. Before you begin your lemon juice routine, it is best to consult with a healthcare professional to get a good recommendation. Number 2. The water solution. Kidney stones may sometimes be small enough to pass on their own through urine, but that will only work if you take a lot of fluids. In this case, your doctor may recommend drinking plenty of water to help flush the stone out of your system. The National Kidney Foundation recommends drinking at least 12 cups of water per day for men and 9 cups per day for women. If you're so busy during the day and cannot keep up with this number, aim for at least 8 glasses of water per day. Drinking enough water keeps your system clean and helps to flush out any excess minerals or other substances that may be present in your urine to form kidney stones. Number 3. Vinegar Remedy. Apple cider vinegar contains acetic acid that helps to dissolve kidney stones and makes them smaller enough to pass out easily through urine. To use this remedy, add 2 teaspoons of apple cider vinegar to a 1/4 cup of water and drink it. Don't make the mistake of taking more than the recommended dosage, even if you want to get rid of your kidney stones quickly, which may push you to drink more than recommended. It is important to note that as much as apple cider vinegar is good for removing kidney stones, the mixture should be taken only once daily. If you take more, you may suffer acid reflux, tooth pain, and sore throat. Number 4. Pomegranate juice solution. Drinking the pomegranate juice solution is another best way to remove kidney stones from your kidney. It is rich in antioxidants that will dissolve the kidney stones in your kidney, flush them out, and keep your kidney healthy. Like other juice remedies, you shouldn't take too much pomegranate juice. A cup or 2 per day is recommendable. However, you must consult your doctor first before taking it. Sometimes you may not even feel that something is moving in your kidney until the stones grow larger than what a natural remedy can handle. When it grows large, you'll experience severe pain, blood in the urine, and fever, requiring you to visit a doctor to remove it. There are 2 common ways to do this. Number 1. Shockwave lithotripsy. This is one of the best ways of removing kidney stones from the body, but it can only be done under strict medical supervision. Extracorporeal shockwave lithotripsy is a surgical operation in which high-energy waves are transmitted into the body system through water and directed at the kidney, where the stone is. These sound waves help break down kidney stones into smaller pieces, making it easy for them to pass through the urinary tract. Shockwave lithotripsy is usually an outpatient treatment and doesn't require you to spend a night in the hospital because it takes about an hour to complete. After the procedure, you may likely feel discomfort, bruises, nausea, or pass out blood while urinating. You may even have to pass out tiny stones from your stool for a few weeks until it is completely flushed out. However, the success of this process depends on 2 factors: the size of the stone and the patient's body type. If the stone is too big or your body type doesn't match it, the chances of the surgery being successful are slim. If you bleed more than you should after the surgery, you may need a transfusion to replace the blood that you've lost, but don't be scared, you can return to your normal activities after 2-3 days. Number 2, ureteroscopy. Here's another way to remove kidney stones from the body system. It is a minimally invasive procedure that is performed under anesthesia with the use of a stent. The stent is a thin, flexible tube inserted into the urethra and passed through the bladder and the ureter. Once the stone is located, a small basket at the tip of the stent is used to grasp and remove it. This procedure typically takes between 30 minutes and an hour, and patients can go home the same day. Over the years, medical practitioners have used these tips to help patients get rid of kidney stones. But then, how about the ways you can prevent and manage them so you don't have to go through the pain of removing them? Here are some quick, natural ways you can prevent kidney stones. Number 1, limit your sodium intake. High sodium levels in your diet can increase the risk of kidney stones. It also causes dehydration, increasing the concentration of particles in the urine and putting you at risk of kidney stones. Reducing sodium intake can help prevent the formation of kidney stones by decreasing the amount of calcium and oxalate in the urine, which are the primary components of most kidney stones. Also, reducing sodium intake may lower blood pressure and decrease kidney stones risk. Number 2, take less of animal protein. Consuming too much animal protein can increase the amount of uric acid in your urine, which can lead to the formation of kidney stones. Try to limit your intake of red meat, poultry, and seafood. If you want alternatives, try garnishing your food more with fresh veggies and fruits. Eating a diet high in fruits and vegetables can help reduce the risk of kidney stones because they're high in antioxidants, which can help to protect your kidneys. Number 3, take over-the-counter pain medication. If you're experiencing pain from a kidney stone, over-the-counter pain medication can help to relieve the discomfort. You can try taking ibuprofen or naproxen, but the doctor must approve it. If you just take any medication for it, you may be putting your health on the line and increasing the chance of the kidney stones growing bigger. Number 4, a change of lifestyle. Lifestyle changes can also be very effective in preventing kidney stones from forming and recurring. Eating a healthy diet low in salt and sugar can help prevent the formation of kidney stones. Also, avoiding foods high in oxalates, such as spinach, rhubarb, and chocolate, can be helpful. Many vegetables and foods like spinach, beans, and even your favorite breakfast of potato chips contain high oxalates, and taking these diets in excess will increase the risk of kidney stones formation in your kidney. Eating a diet that is low in oxalates as well as high in calcium can help to prevent stones. Fruits like blueberries and blackberries can reduce your oxalate intake because they only have 4 milligrams of oxalates per cup. They are also rich in antioxidants, which can help prevent diseases such as heart disease and cancer. If you consume food that contains large amounts of sugar-sweetened drinks or food, it will lead to diabetes, which can in turn increase the risk of kidney stones. Avoiding these drinks or food items can help to prevent kidney stones from forming. Salt can increase the risk of kidney stones by making the body retain more water, leading to an increased mineral concentration in the urine. These minerals form crystals and accumulate and eventually form kidney stones. Additionally, a high-salt diet food can also lead to increased blood pressure, which is a risk factor for kidney disease. To limit the salt intake in your body, try to avoid using it raw or using an excess of it in your meals. If you're prone to kidney stones, your doctor may recommend additional changes, such as taking a calcium citrate supplement or avoiding certain medications. Calcium citrate may be helpful in preventing kidney stones in some individuals because it increases urinary citrate excretion, thereby preventing the formation of kidney stones. Note that these tips do not replace medical advice. If you suspect you have a kidney stone or have a history of kidney stones or suspect that you may have one, it is essential to consult with a healthcare professional. Thank you so much for watching. Please like and subscribe for more videos just like this, and I'll see you in the next video.